into today's module. I research on mental health at the African Population Health Research Center. My interest is in child and adolescent mental health. I've been working in that area for the last 5 years, and as you can imagine, and you may know that it's an area not just in Africa, but globally that has been neglected for a long time. So it's really an opportune moment for us to be at the center of initiatives that try to make available data for evidence-informed decision-making for policies and programs that can be able to solve this issue that has perennially been neglected, and not just for child adolescent mental health, but general public mental health. So that's my profile at FHRC. And this really is the right place to start for Mental Health Data Prize, to discuss mental health and why it's important, but more importantly, what will be the focus of the data prize in terms of the areas that will be considered fundable. So our outline for today, we'll be looking at really mental health. And sorry if you're already familiar with this, we cannot assume that everyone else can conceptualize what mental health, can define it properly. So we'll go through that just for to refresh our understanding of that. We'll also look at mental health disorders, but we'll zero in on why anxiety, depression, and psychosis is really important. And I'll borrow some approach from the Wellcome Mental Health Strategy that is operational right now, and it's for obvious reasons, because this prize will eventually be awarded by the Wellcome. And then we'll be looking at forms and types and designs for research in mental health. And finally, just shortlist some of the tools that we have identified that can be used for population screening for mental health, and some of those that have actually worked in Africa. Some of those tools will perhaps be validated, others will be new, but we'll be listing them, and some of you perhaps already using some of those. So this is our outline for today. And we hope that by the end of this session, you will be able to properly define mental health for those of us perhaps consider uninitiated in this area. We should be able to understand mental health disorders and illnesses, and especially those that we are interested in for the prize, and appreciate the focus of the prize on anxiety, depression, and psychosis, as it were. And finally, appreciate some selected approaches for research in mental health. I see my internet dwindling a bit, so allow me to put off my camera just so that we can assure continuity in this session. Again, I have to find that. Okay, there we go. Yeah, with those objectives in place. So mental health is really defined as a state of well-being in which the individual realizes their own abilities, they can cope with the normal stresses of life, they can work productively and fruitfully, and they are able to make contributions to their community. If an individual is able to do this, if they can willfully do this, they can easily do this, they can, without strain do this, then you'd consider them to be mentally healthy. And therefore, it means that a person who is mentally healthy can therefore enjoy good or healthy relationships with their other people. They can be able to properly put their thoughts together. They can think with clarity. They can think clearly. They can cope with the normal stresses of life, seeing as stress is always in and around us, and we live in a fast-paced environment, and we actually get, to deal with many issues in life, in many facets of life. And a mentally healthy individual should be able to cope with such kind of normal stresses in life without taking a toll on their physical health, on their mental health, on their emotional state. They can be productive at school or at work if they're mentally healthy. And finally, they can participate ably and willingly. I think the key word to underline there is ably and willingly in community activities. And you'll see how this really link with the symptoms that are actually used to diagnose some of these conditions, and especially anxiety and depression, the mood disorders, and psychosis to some extent. That if we look at those symptoms closely, they actually align with these facets of life that either define someone as being mentally healthy or characterize an individual to be mentally healthy or not.